My name's Mary O'Connor, and I'm an orthopedic surgeon at the Mayo Clinic in Florida. And I'd like to take a moment to talk to you about your bones and your bone health, because it's really a very important subject, not just for women, but for men, children, and basically everyone in our families. I want to highlight the importance of building strong bones when we're young. What basically happens is we build our bone strength as young adults, and then after that, the strength of our bones decline, and what we're trying to do is keep the strength high enough so that we don't have a fracture. And for women who are beyond menopause, the risk of a fracture related to weak bones is actually higher than the combined risk of getting breast cancer, having a heart attack, or a stroke. So this is a real serious issue. Over the age of 50, 1 in 2 women will get a fracture in their lifetime. And for men, it's 1 in 4. So it's equally important that men understand the importance of bone health and keeping their bones strong. So we need to understand the things that are important to prevent fracture. So the fundamental things that you need to know to keep your bones strong are the following. You need to make sure you're getting enough calcium in your diet. Why? Because calcium is the building block of bones. If you just take one supplement of 500 milligrams a day, that combined with a normal diet where you're paying some attention to your nutritional needs is probably going to carry you to your recommended daily allowance. Vitamin D is a little harder to get in our diet. It's not contained in a lot of natural foods, mostly fatty fish, egg yolks, cod liver oil, so things we might not eat all the time. Another way to get vitamin D is from the sun, because the sun will convert vitamin D from the fat underneath our skin into the vitamin D precursor. But if you go out into the sun and you have sunscreen on, that's going to block the production of vitamin D. And especially for people, for example, here in Florida, where skin cancer is a real issue, then most of the time we're wearing sunscreen to protect ourselves against the harm of the sun, and that of course then limits the benefit that we get from the sun with vitamin D. So the simplest, easiest thing to do, I think in my mind, is to just go purchase a vitamin D supplement. You can take 1,000 international units a day. You're well within the range that's acceptable, and then you know that your vitamin D needs are well covered. The third thing, which might actually be the most difficult, is weight-bearing exercises. And I know it's hard to make time in your schedule because I'm a very busy person and I struggle with that sometimes too. But it's really important that we regularly exercise with weight-bearing exercises. Don't be afraid to go to the gym and lift some weights. Run. Do some kind of impact activities. That helps strengthen our bones. The fourth is medication if you have weak bones. And so when we get older, our primary care doctor would be ordering a test called a bone density study. And that test will measure the density of our bones and will give our doctor an idea whether we need to be on a medicine to help strengthen our bones. These medicines have been tested and shown to decrease the risk of you getting a fracture. So that's a very good thing. There's also some data that has come out that with long-term use of these medicines, that some of the drugs can make the bone more brittle, and if a fracture occurs, it can be harder for the fracture to heal. We know this can occur. We also understand that it happens very infrequently. So the consensus is that it's the benefit of taking the medicine to strengthen your bones and prevent the fracture outweighs the small risk of you developing a fracture because you've been on the medication. After a hip fracture, 25% of patients have to go to a long-term care facility. And I think that most of us know someone in our family that has had a fracture and had problems related to regaining mobility and regaining independence after this. So it's really critically important because we want our golden years to be filled with independence and quality of life, and not with walking with the walker or cane because we broke our hip and now we just can't get around very well and we can't live by ourselves, etc. So what is most important is that we pay attention to our bone health and make sure you're getting your calcium and your vitamin D, doing your weight-bearing exercises, and then seeing your doctor for your bone density study if you're over 50 to get that checked. And also, for all you parents out there, I want to emphasize how important it is that we focus on our children and make sure that we're giving them the nutritional supplements that they need, that they're getting their calcium and vitamin D, because they really need to build peak bone strength when they're young, and we want that strength to be as high as it can be, because that will make their bones healthier and better for them as they become older adults.